In today's fast paced world, the decision to have a child often happens because of expectations, timelines, and unspoken pressures. But how often do we pause and truly ask ourselves questions like, why do I want to become a parent? Am I emotionally, physically, and spiritually ready to bring a soul into this world? In this deeply reflective episode, I am speaking with Sidanta Gogate, a spiritual fertility coach who encourages us to remember the sacredness of conception and parenting. We explore the importance of consciously choosing parenthood and cleansing and preparing the body and mind for conception before welcoming a child. Because preparing to become a parent is not just about biology, it's also a spiritual intention. This conversation is a gentle yet powerful reminder that when we choose to parent from a place of awareness, the impact can run through generations. Hope you enjoyed this episode, and now let's go over to Sidanta Gogate. Welcome to Ayurvedic Healing and Beyond, Sidanta. So happy to have you.
Thank you so much. It's an honor to be here.
Sidanta, what got you into this profession? What you're doing? I mean, what's the story behind this?
So now I have a story in place. Few years back I did not, but I'll like to give an example of how the universe conspires you to be in a certain space, doing a certain kind of work. So if I look back into my life, my grandparents, they were the first medical officers of their district, followed by my parents who were gynecologists. And then I have seen like two generations of medical practice living there. You know how earlier used to be like you have a hospital and then you live there itself, right? So very engaged in that system. But I grew up not wanting to be a doctor, just because how medical practice was changing over a period of time. After that, I also had a lot of health issues in my 20s. So, going from psychosomatic to neurological, joint issues, lot many things. And allopathy wasn't helping actually. So, that's when I ventured into alternate healing, holistic therapies. The first alternate modality that I was introduced to was pranic healing. I did pranic healing, pranic psychotherapy. I understood a lot about how energy works, what is the electromagnetic field of the body, how to manipulate it, what chakras are, all these things. So I did that. I healed myself to quite a big extent. And then I started practicing it also. Meanwhile, traditionally, I was into law school. So I completed my BA LLB. I was practicing also litigation for some time, but I was always interested in metaphysics, in holistic approaches because of my grandfather. He was a very miraculous doctor, you would say. Like he had that healing touch along with a lot of wisdom and intelligence in the medical field at that time. So, and I was brought up by my grandparents, essentially. So they had much more influence on me. Watching them in their clinics, at home, everything was kind of imprinted. So there was a natural inclination to also try Ayurveda or alternate modalities always. After that, some time went by. I am also trained as a helicopter pilot. So, but because of that, I got into a major accident and I had bone injuries.
Did you crash with the helicopter?
No, I did not.
Okay.
So something like that happened, and then I couldn't do it anymore because medically I was unfit to fly. So that led me to, okay, pranic healing cannot fix musculoskeletal issues. So what do I do here? That's when I ventured into yoga therapy. I was very fortunate to meet a lot of good teachers, good gurus. Got through, I just went there for the asana part, the therapy part, but I ended up learning Ashtanga, Hatha, the entire philosophy. There was a brief period over there when there was a course going on of pre-postnatal yoga and Garbha Sanskar. So I was like, I'm already in the ashram. I've already learned so much. So let's just see what this is also. And I remember that Guruji's wife had a very, very profound effect on me when she was teaching us Garbha Sanskar, what it is about, and thanks to this generation that we have all this research in place, so you tally everything, right? Because people need to know medically how it resonates, and then I learned nervous system, epigenetics, all the influences, all those things. So it's like a very long story short, but that is what happened. After that, I was just working with women to heal PCOD, endocrine ailments basically. And I was seeing very good results with yoga therapy. I was also wondering what is that part of yoga, other than the asana, which I can teach in a much better way. Also, always wanting to see the difference between all the yoga gurus and the teachers that are teaching in a TTC setup. So I was like, if these teachers, they've been teaching these subjects for such a long time, they know much about what goes beyond asana as well. So in theory, if they know this, then what is the difference between a yoga guru or someone practicing in the Himalayas and then someone teaching, then learning all forms of yoga, karma yoga, bhakti yoga, like how people venture into different forms. Just curious about my own life. There were a lot of things parallelly also happening in my life. Lost my parents also in between, so a lot of psychological shifts, major life events, lost my grandparents, all of those things. So I was also personally seeking someone who would guide me for the rest of my life. That again led me to another guru, and I think that's where all the search seeking ended. All the questions, got a full stop. He taught us so beautifully about all the systems of the body. Being a Himalayan yogi himself, how he managed to really transfer all of that knowledge to the new age mind. That shifted something major in me. And then in his program, I got initiated into Omkar Sadhana. So when I came back, I was just doing that. And then, you know how your senses keep on sharpening, right? And then your observation skills, like the drishta bhav that you have, starts sharpening again. So I was watching all these influencers on Instagram, all the yoga teachers teaching poses for healing PCOD and other things, whereas it is more of a lifestyle and mindset issue as well. Um, saw a lot of like, I was actually initially very taken aback just watching the marketing of the entire what do you say, all the metabolic disorders and how teachers are portraying it, like do these 4 asanas, do these 2 asanas, and that's also fine. But then I used to read the comments there, and so many women, like it was always there but it was never really in my notice unless I started noticing. And then you have all these women like just weeping in the comments, going through so many things, miscarriages, not able to conceive for many years. Even comments like they've been practicing yoga for like 4 years, 5 years, nothing is happening. Done Ayurveda, nothing is happening. Medical procedures, nothing is happening. So I was kind of just meditating on that and studying side by side, meditating on it constantly. That was a fire. I don't think I was thinking. Something in me just woke up during that phase of my life. And that's when I started pondering, started talking to doctors, like everyone that my father was in touch with. So started talking to his colleagues and just observing around, started talking to my teachers. So got to know quite a bit, but something very different hit, and the pure credit goes to my meditation practice and the Omkar that I was practicing. Because of that, Garbhadan showed up in my life. And the thought of how does one person just think about, like, I want to have a baby right now by hook or a crook. How did we get to this point? And infertility, if you see, where is infertility? Every second there is a child being born in India. Where is infertility? At the same time, you look at this whole Instagram world, everyone promoting reproductive health, fertility, and so many users seeking help. So I was just meditating on how to bridge that gap, and that's when I think everything came together. It was months of just sleepless nights and just thinking about this, reading upon things. And then I formulated, when I got into Garbha Sanskar, how we were taught is you have to do Bij Shuddhi, Garbha Shodhan, right? do
Can
Ayurvedic.
you translate those words? What do you mean?
Yes, you have to, make sure that you purify and strengthen your egg quality, purify the beach, which is sperm also, the sperm quality, enhance it, diet, lifestyle, exercise, sleep, your bonding, and then do certain rituals, certain Vedic rituals, and then you conceive. So, conception, how it was taught to me, was very intentional, that you prepare for it, and nobody was really doing that. So I was also wondering, what is the preparation that is lacking if these people are saying that they are doing all the things that are required. So then I started noticing that they are actually stressed about everything that they are doing.
Mhm.
And because they have a to do list now, along with their life they have to follow this also, so anyway they are going into stress, and there is no one size fits all solution also
Mhm.
here. So got deeper into what is required. What does preconception preparation really mean for a
Mhm.
couple? Earlier, I did come up with a standard template where I tried to cover everything, because in between I upgraded myself, not just with pre postnatal, but I learned NLP also, just to again design my own meditations. I designed my own yoga nidras for subconscious healing and other things. So I came up with a system that will work for the modern audience. So we have modern practices also, as well as all the Vedic things that you need to know.
So, Siddhanta, where did we miss the bus? Like, on one hand, we see so many kids being born in India, well,
Yes.
everywhere. And on the other hand, you are seeing struggling couples. Like, they're struggling, they have tears in their eyes. And I see so many patients coming with infertility issues,
Yeah.
and they're trying to conceive. They've been trying it for like multiple years, trying IVF and failures. Where do you think we missed this bus? And I think that's where you are trying to solve. But where do you think we missed the bus as a humanity?
I think we missed it, not because, not on very honestly, not because of us, but because how the societal structure is changing, how the education system changed, and then the whole career transitioning and career paths changed, and then that made a delay in deciding to get married or not married, and then just lot of delayed decisions basically, because we are in a generation, or even earlier, if we see, we are transitioning right now. But if you look at it, people completed their education really late and then got settled really late. In that term, settled really meaning getting a job and then at least owning a house and then getting married. So this structure really changed. Like everything is happening very, very late.
Mhm.
So to get stable in life, settled in life, whatever that definition is for anyone, it's taking a lot of time, right? And what we did not consider is the biological age.
Mhm.
What we did not consider is our day to day lifestyle and the stresses that we are taking on are affecting us on a metabolic level.
Mhm.
So, you might be settled when you're 30, but the stress that you took on yourself, the habits that you have gone through in those times, aged you metabolically. So, your body might be 45 right now
Mhm.
from inside, the health of your organs and other things. So, it might be 45,
Mhm.
right? Now, we know that it's more challenging for women, but if you look at the content also, or the information, it's very recent that people have started talking about equality and how age affects it.
Mhm.
That was never there before. And then the comparison started, like the previous generation had 4 or 5 children, I'm not able to have one also. But we did not assess the factors, let alone, I agree that there are some factors you cannot control, which include preservatives, which includes pollution. I call it the three P's, and the external pressures. Certain pressures we cannot avoid. But what we have to do is increase the stress adaptability.
Mhm.
You know how I always give this example, there are two people in the same situation, right? But both of them, if it's a stressful situation, both of them will perceive it very differently sometimes. We
Depending on
all,
their tolerance level,
yeah.
yes.
So that tolerance can be improved when you're following yoga abhyas and certain lifestyle habits, right? So that was one thing. And second, everyone took it as a mechanical process also, that okay, school, now college, now marriage, then child. So because everything has happened on its own till now, pretty much, with minimum efforts here and there. A child will also happen. It's a very natural thing, so it will happen. So it is a natural thing. But the more you live outside of the rules and protocols of nature, right, it is going to show up at some point. So it was always happening. You were just not aware.
But on the other hand, I also see there is a group of women, you will see that they are giving effortless birth,
Yeah.
even in their late 30s or early 40s. But yes, statistically and biologically, the more delayed a woman is giving birth, the possibilities of complications can go higher.
Good.
But as you said, it is the metabolic age and the inner biological age that you're talking about. And especially, I mean, for the kind of people that are listening to this, if they are already post 30 or in
Yeah.
their mid 30s, telling them you should have done it earlier, it doesn't make sense. It's only guilt tripping
Yes.
them and putting more stress to them.
Absolutely.
So, what can we educate them how to revive their biological age, how to improve their, in their metabolism can be upgraded, and a lot of this can be reversed to a great extent.
Absolutely.
And if you look at the scientific part, as long as the anti-Mullerian hormone levels are normal,
Yes.
she is fit to conception as long as the other aspects are there. There's no other issues with
Absolutely.
that. There are even exceptional cases in late 40s. The first birth came out to be very healthy.
Yes.
But these are just once in few examples. So when you take the total combination, of course, giving birth to a very early age makes a lot of difference.
Yes.
There's no doubt with that. But the construct of the society has evolved to such an extent. You need to learn, you need to work on your career, you need to also feed for your family.
Yes.
These things are coming in this construct. So I think that's where you're trying to,
Yes.
bringing them back to the nature.
So that's where we are working majorly with also, because it's assumed that now in your 40s you're planning for a child, so you're very well settled, right? You're financially secure, other things in your marriage are also good, and now you have the headspace
To think about it.
think about it, right? Now when it comes to reverse aging, right, there are so many things that you can do to slow down your aging process. Number one being, again, cleansing, like I was talking about, and nothing better than doing a panchakarma, right? So consulting someone who's really noteworthy in their field, that is again very important. And then going through, as a couple, going through panchakarma is going to release all that chronic stress outside of their body. Now, how people relate to stress is very different, because most of my conversations are like this. But like, my routine is fixed, right? I eat good, everything is fine, I'm really not stressed. But once they start getting into the relaxation practices is when they realize how actually stressed they were, right? Which also means, how I like to explain stress to people is, it's not that you are in a stressful situation all the time, or you're thinking about something that is stressing you. Any of the 7 tissues of your body, if they are depleted, any of the 7 functions of your body are not happening at the optimum level, the brain is going to be under stress, because it is trying to preserve everything, and reproduction is going to be the last thing it is going to care about.
It's a luxury.
Exactly. So if others may basic things in your, like, people say, no, I just have constipation, I just have this, but they don't understand the gravity of it and the role of it in improving their egg and sperm quality, right? So again, like you said, education is the most important thing, because when I started telling people that it is the 7th tissue and then you need to nourish all the first ones to reach to it and all of those things, then there are things like oxidative stress, acute, chronic. So some things you will be adapted to, some things you don't know what damages are happening deep inside until you start those detox practices. The amount of energy you will start having, the calmness that you will start feeling, everything. People say, there's initial stages, there's no major difference, but my skin is glowing, I'm feeling calm. They take it for granted. So that should not happen, but you continue and then eventually they'll realize. So when it comes to age, it takes 90 days, okay, to, even if you have poor egg quality, because let's assume that, like, the worst case scenario is you have an AMH of 0.4, right, or 0.2 even, right, and you're 42, okay. There's no point in thinking about I have low AMH. If you want to have a child, you you fixate on what you want to think about. Think about the egg quality. I want to improve my egg quality. That should be your only thought. Don't stress about how much AMH you have and other things. Now, what are the things responsible for your egg quality? Enhance your thyroid, enhance your vitamin D, enhance your brain health, your hypothalamus, all these things. So basically, the body is capable of healing itself and bringing itself back to how it is supposed to be, how nature designed it to be. But you need to give it the time, space, and energy. And it will do that in that 90-day cycle. Similar thing will apply to a man as well. It is very well proven, if he starts exercising, if he sleeps well, because testosterone is directly linked to that. So sleep really well, 8 hours of sleep, and not in a way that you're sleeping at 2 a.m. and then waking up at 10, because there's a thing called growth hormone in your body. You need a specific time. You need to sleep in that specific time for it to be active, for it to heal you. That is what people usually sleep for. Sleep is just for the body to rest and rejuvenate, right? But again, a lot of things we are taking for granted, one including sleep. So for males, it's much more easier. Exercise, sleep, good nutrition, 3 months. For women, because the hormonal cycle is a little more volatile, right? Educate yourself on cycle syncing. Start behaving as per your cycle. 42 is still not really an age to reach menopause, because women are having children. Even like in my experience, even at 46, we have had amazing cases, very natural birth, also natural conception, natural birth, and a very healthy baby at 46. So it's possible. And like you said, but it's more like, because I am on this side of the table, there are many women conceiving at even 45, 46. But considering that your metabolic age matches
Your physical
your
age, yeah.
biological age, at least to some degree, then it does happen for those women also.
Yeah, you could be, according to your identity card, you could be in your 30s, but you could be 45.
Exactly. And this is what the IVF industry is also harping on. The fear mongering and the marketing. It is happening on such a ridiculous level that I have a 26-year-old, 1 year of marriage. They tried only for 6 months, not happening. Directly jumped to IVF. 26-year-old girl, she has gone through 7 cycles of IVF.
And she tried it only for 6 months.
Yes. Like even the healthiest couple, you need to give them that 6-month mark to conceive. Now here, let's see the generational difference that we talk about. Oh, earlier the air was so clean, the food was so good, this, that. Okay, it might take a little bit longer. You might need to, prioritize where you spend your money. Spend on organic, spend time in like panchakarma, therapies, massages, relaxation techniques, whatever, classes, therapy, whatever you need for your life. But there is a way. And then this girl going through 6 months of just natural therapies, and then within a year, she conceived naturally. So there are a lot of unnecessary IVF also happening, which is damaging the body. So what the program that is for 3 months, she needs to follow, or the couple needs to follow for 6 months, just to bring them back to, homeostasis. And from there they start improving. So my word is, IVF, I always say this, IVF is not going anywhere. Give yourself a year and a half even, without worrying about your age. Trust me.
Only then, as a last resort.
It should always be the last resort. And there are some amazing medical doctors who are coming up with more and more solutions. Like One of my clients, she was suggested IVF itself by too many doctors, and then she consulted this other one, and he suggested super ovulation, and she conceived.
Can you explain that?
So basically, you trigger the ovary to produce multiple eggs in your cycle, so your chances of conception are higher. So that's the super ovulation process. It's also like a very personal decision because everything was fine with them and they were just really longing for a baby. So it was more of an emotional desire, and they felt like they had worked on everything that they could. So they improved their egg quality, followed all the protocols, went through cleansing, done everything, but then they did not want to really try naturally. Their intimacy, their sexual life, everything was good, but they wanted to take that pressure off and reduce the time in which they will conceive.
Okay.
So they opted for super ovulation.
And there's no complication with that,
There's no complication in
other
that.
than the fact that there's a slight artificial
Yes.
intervention. Yeah.
Yes. Anything allopathic, there will be a
Intervention. Yes.
yeah.
So if I just go through what you mentioned, only when they do the meditation and they feel relaxed, they realize how stressed out they were in the first place. I think many people are, the saying, when you have a itchy skin, and when you've been itching for it too long, you forget what it means to have a healthy skin.
Exactly.
And that itchy skin becomes your new normal and your pleasurable part.
Exactly.
And then suddenly, so I think if everybody has a memory of what it means to relax, many people lost that memory.
Yes.
I think that's
majority chunk of it.
I think that's where they are not able to. They think, okay, this is the new life, and I have to.
Yeah,
live
and their
with it.
environment is also like that. The people
they're not
that
questioning
they are,
it
yeah,
also.
the people they are surrounded with, they are also just like that. So they never really think about it. And then everything becomes a voodoo. Yoga becomes a voodoo, meditation becomes a voodoo, everything becomes a voodoo. Till you have no choice. So now more than ever, if you have the awareness that alternate modalities are really proving what they can do, what their potential is, first always opt for that because the body is going to respond quicker. Because it's natural for the body to receive all of that. So it's going to respond very, very quick.
I think the stress adaptability is I think it's the biggest new skill that everyone can have for the 21st century healthcare.
Yeah.
Looking at how things are going.
Definitely. Everyone wants to know everything, but what will you understand if I tell you about, okay, your nervous system is, dysregulated and we need to, reduce the impact of your sympathetic and parasympathetic, we need to improve. They're not going to understand any of it. But it sounds good to the logical mind.
Yeah. We need to know the logical side here. I mean, when I sit with my father during my younger days of practice, he has a habit of prescribing, and in his time, the patients never questioned.
Yes.
Whatever you prescribe, I surrender to this.
Yes.
It's not like you're putting them on their throat or something, but they're just like, okay, he's a doctor, I need to trust him. So that real, he's a patient, there is a doctor, and they trust. But today, I mean, of course, there are many malpractices going on.
Many.
I realized today, if you want to be a successful doctor, you have to take time to explain the logic.
Yes.
And the more I explain, I feel the more they listen to me.
Yes.
And the moment you say you need to take this, and if I don't give an explanation, how will I trust you? The trust factor has gone down the lane over the years.
Absolutely. There are couples like, you explain it so well. Why this thing? Why did the doctor not tell me this? See, I heard this from a doctor himself. Doctors are trained for treating illnesses, not for wellness.
I think you're talking about allopathic doctors.
Yeah. Yes. Specifically allopathic doctors.
No, what I say, allopathy is an answer to humanity's question to prevent death.
Yes.
I mean, they developed the science to prevent death, pain. That's why they have painkiller, they have antibiotics, they have steroids, immunosuppressants, which is fantastic, which is why we are alive. But as you said, just because a person is alive doesn't mean that person can be fertile.
Exactly.
That's a different thing.
I'm just saying that everything has its place.
Yeah.
And it's just purely lack of awareness or lack of knowledge that you don't know which one to approach first. I knew, like now that I think, psychosomatic, I have seen in childhood, like when I was in school, I was in like fifth or sixth grade, and I used to come back from school, and I'll go to my grandfather's OPD. I will sit there, case papers. That time we had like a very different organic system, and then patients will come, and he'll just speak to them, and they'll
Hmm.
feel good, right? One of the biggest aspects of being a doctor, I think, is that seva bhav also needs to be continued.
Hmm.
So you just speak to that person for a minute, and he will calm down. And sometimes though, I've seen him just give like those pink glucose things, just for relief, because he knows there's nothing wrong with this person. So I think you need to have that centeredness also,
Absolutely.
regardless of whether you're allopathy, homeopathy, whatever, Ayurveda, you need to have that
At the end of the day, it's a
drishti.
quality of life. And recently, there was a patient who came to me with burnout. And she had a burnout because she was taking care of her mother who was going through a
Yeah.
terminal disease and cancer.
Yeah.
And she was telling it was a tough time with her. And sometimes in some countries, the support system need not be that great.
Yes.
And there'll be a very nuclear family. So she was taking care of her mother and she had to quit her job to do this. And she was telling her oncologist, her mother's oncologist said, there's no point doing radiotherapy or chemotherapy now. If you do this, maybe she will be alive for a few days, but she's going to be alive with a lot of suffering.
Yes.
It's better, the inevitable happens sooner. That's the best thing.
Yeah.
And she was coming and telling, and she was saying that that's the best decision the doctor told us to take.
Yeah.
Because, so somewhere people are also realizing sometimes if the treatment is creating more pain than the quality of life, maybe you need to choose which is best.
Absolutely.
So now a lot of thinking are changing and people are realizing at the end of the day, just being alive is not enough. You need to have the quality of life
That
also.
is very true. That is very true. Because, see, because of the, like you said, support system, just connecting to that, our family structures have also changed, right?
Mm.
From joint to small to nuclear. Because of that, also, whatever ancient, that interruption that we had of ancient wisdom in the family every now and then, because that is also missing, there's again brings us back to lack of awareness and knowledge about all these modalities, because a lot of people might be naturally inclined to it, but they are not aware that something like this exists.
Mm.
So even if we speak about a natural approach to conception, like even if you're 26 or 46, doesn't matter, how you decide to get married, how you plan your wedding. Similarly, nowadays, even pundits, you want to get married so fast. You want to just enjoy all the functions, but not really pay attention to what the Brahman is saying. Half the times, the Brahman also doesn't know what he's saying.
You mean the
And
priest? Yes.
yeah, the priest, right? And some good ones I know, they actually try to explain the couple, but they're like, Panditji, it's too boring. Let's just move on to the next thing.
Mm.
That's the first mistake I feel. If you found a good priest, listen.
Mm.
Whether to take it or not, apply it or not, is a different thing. Take your time for that. But at least listen, because that's a privilege right now. And then, just as how he explains you everything about the duties, right? Similarly, Shastra also, like our scriptures, also prescribe a way to, how to have the most optimum and healthy progeny. And then right now, though, because we are speeding up process due to infertility and other things, but let's say a very healthy couple, once they decide that they want to get married, they go through their marriage. Number one, most of the things, because I look at those aspects also. So this, the most common issue in delay also, is pitradosh, nadidosh, poor Saturn and Jupiter,
Mm-hmm.
right? So these are also things, no matter what you do, how many treatments you do, it will be delayed,
Mm-hmm.
and there will be some problem or the other. Now every problem does come with a solution, but you need to know what the problem is before. Let's say we did not check all of that, we just got married, right? And then take a year. Now you're just thinking about it. We should think of having a baby now. First thing, how is your physical health? Start improvising that. Again, stress adaptability, more so with emotional and mental health, how you deal with situations. That when I speak about emotional mental health, I think we can curb a lot of issues if we start developing our character, our moral, our value system, whatever it is for us, but having a solid belief system for ourselves that works for us in our favor, that is taking up us up in life, right? So start assessing your thought patterns. If something is not working for you, change it. You don't have to be the same person that you are before having a child. So just swadhyay, right? Just inner reflection,
Mm-hmm.
self assessment, because after school, after college, we just get busy. We don't have time to think about all this. So once we know someone is going to come into the family who is going to uh, imitate us, let alone like replicate, right? You need to think about how you're thinking, how you're behaving, how you're acting, consciously also, subconsciously also, unconsciously also. So get a check on yourself, basically.
An audit.
An audit. Exactly. Do that. See, and what most couples take for granted is also the intimacy part, because so many things are going to change after having a baby. So this is also a very good time for you to, really form a very deep connection instead of just focusing on baby, because that is an outcome of something, that is a result of something. You can't control when it is going to happen, right? So doing that, and there are beautiful rituals also that are prescribed that you should be doing. And most importantly, setting an intention. I'll give you an example, because Garbha Sanskar is continuously, it's about having a sattvic
Can
baby,
you translate the word Garbha Samskar so that?
basically epigenetics, you know. So Garbha is the womb, and sanskar is the impressions that we create on the womb. So womb, we are basically referring to the fetus, right? So
It's like making the soil fertile.
exactly.
Can we say that?
Yeah, absolutely. Because it's one thing to have a seed. So let's, if we take an example of a plant, right? You'll get all qualities and kinds of seed for the same plant, right?
Yes.
The organic one will be the most expensive, right? But the returns are going to be higher, right? It might need a little more care, really high quality soil also, right? So the male's part is to optimize that seed that he is going to offer in the womb,
Mm-hmm.
right? And the lady's job is to create that environment inside of the womb, so that organic seed can grow up to its fullest potential,
Yes.
right? So it goes both ways. And now more than ever, earlier it was only women, miscarriages, women, right? Now it is very well linked to male sperm.
Mm-hmm.
Number of miscarriages, any organ abnormality, right? Neurological defects, everything is being tied, placental development, everything is being tied to the sperm on papers. So now so there is no escape, no reason to not follow anything. Then in energy world, we also say that energy will stay wherever there is an empty space.
Mm-hmm.
So, because women are not really conscious of their menstrual cycles, the cycle syncing part that I was talking about, just educating yourself about how your mindset, your emotions, and your physical energy shifts as per your cycle. So, every week of your cycle, you're going to be different.
Mm-hmm.
Whereas a male's hormone profile is pretty much stable. So learning that is very important. You will start understanding where to conserve energy and where to give your best and when to do that. So we say that if you're carrying a lot of negative energy, let it be physical, let it be mental, emotional, that energy is going to get stored in an empty space, which in a woman is her womb.
Mm-hmm.
So a lot of the times, miscarriages, it also happens because the emotional mental health of that woman is not that good.
Mm-hmm.
So once she has conceived, because understanding the relation between emotions and hormones.
I think that's just one aspect of
Yeah,
it, but it can make a big contribution to it. That's what
a
you say.
very big one. Why? I'll like a small example. So there are two sisters, right? The elder one had conceived, but she lost her baby in the third month.
Mm-hmm.
So the younger one was so stressed about it, she conceived. There was no reason for her to miscarry that
But
child.
the stress and
But she
anticipating.
continuously only thought about her sister's miscarriage. Continuously. And she lost the baby. Having that inner realization later that this is the thing I was doing. I was continuously just focused on my sister's miscarriage, and I miscarried the baby. Like, I know it in my soul that is the reason. Because everything was normal, reports are normal, everything is normal.
That's like, don't think about the green hippopotamus.
Yeah,
That's the only thing that will come to your mind.
exactly. So do your rituals properly, nourish your body properly, right? And that will automatically reflect in the egg and sperm quality if you start taking care of yourself, right? And then in divine timing, let it happen.
And can you explain about this 90 days? Why 90 days?
Yeah, because see, every cell in our body is constantly dying and a new cell is generating, right? So for the entire body to renew its cellular structure, it takes 90 days.
And that's why you
That's
have the HbA1c is a average of 90 days.
exactly.
Even the
So
sperm cycle, it's 70 to 90 days.
exactly, anything that you want to change, you can look like most of the transformation programs are 3 months.
90
Why?
days. And 3 into 3 is 9 months.
Exactly. So that's how the body is designed. So it doesn't matter how much of a hellhole you are in, you can get so much better drastically if you just focus for 90 days. Especially men who come with like addictions and like very tough schedules and things. Just 90 days, prioritize this and then do whatever you want. Like
Makes a big
that's
difference.
the bare minimum that you can do, because it reflects in how the baby's growth happens in the womb. Like I said, the potential that the seed has, that much only it is going to grow. Doesn't matter how much fertile soil you put it in.
So it's like what you do today, you will see the effect 90 days afterwards.
Yes, and with Garbha Sanskar, like the practices that a woman does month to month of her pregnancy. So we do it in Garbha Upanishad. It is prescribed that every month, it is stated that every month what development is happening and what sensory organ you should focus on, what brain development activities you should focus on, what emotional mental practices you should focus on. So it is all given in our scriptures. So if you just start following that, you will see a baby that comes who is, I want to say, very parentable. Because most of the children either very antisocial and underactive or very hyperactive. So, and I have seen so many parents just frustrated about having a child. Like, why did I do this?
So you think it's all starts with the preconception thought process?
1000%. There is no doubt about it. You can't like, if you come to me now, look, but I am already 6 months pregnant. Of course, there are things that you can do. Will it be the same like preconception? No.
So the conception of that thought that you want to have a baby, get your acts
Exactly. They
correct.
say that the moment conception happens, right? The sperm fertilizes the egg. What season it was? What was the predominant dosha in the male and female's body, right? That determines everything of the child. The height, the body structure, hair, skin, nails, everything. Even the mind. Then what are you talking about? How much you're going to change things? So everything can be controlled pretty much before the point of conception. Another reason why this is more important is because birth defects are increasing. ADHD has entered here. So many neurological development issues are happening. Autism has already entered India. Why? Cardiac disease, infant cardiac diseases. Why? Because they think they are perfectly healthy.
So what will be a checklist? Let's say a typical metropolitan couple going
Yeah,
through. They
first,
both are working.
yeah,
They both are trying to have a baby in their mid 30s or early 40s,
yeah.
let's say,
First
and they have made it
things
to their career and they have certain issues. What would you take them through for the girl and the man?
first, because we are talking about the metropolitan crowd, first go and get a full body health checkup done and a complete sperm morphology done, analysis done. For the female, also get the entire hormonal panel checked and everything, especially full body, because the most issues are about thyroid, right? Thyroid malfunction. Um, on top of that, I would also go and say Suppose this is just an example. Now, if the normal range is 0 to 4, right? And if your report is 1, it is still going to show normal.
Mhm.
I want you to be on the higher range of that normal range. So go up to 3. Because 10 years ago, if the normal sperm count was 10 million, now they say it is 5 million is normal. And for IVF, you need even lesser than that.
Mhm. Yeah, because they can manually select.
Exactly, right? But if you want to try naturally, let's say you have very good sperm volume, sperm count, but the morphology is poor, the structure is poor, still it is not going to work, right? So try to be on the higher ranges of whatever blood work that you're doing.
Mhm.
That is very important, because these metrics are also man-made and they keep changing every 10 years. Because infertility also from 2012, if I'm not wrong, it was 3% in females. Now it's 33%, which is huge when it
Mhm.
comes to Indian population. 33% is huge. And male infertility, 50% drop
I
since
see.
2009.
That's a huge alarming situation.
Yes. And now this is sheer luck. I truly believe this is sheer luck, because I like the clients in my program, they come up like I see these reports all the time, right? And it also depends on the women, on what time of her cycle she's getting tested. So that is another very important thing to see. But if one lab shows one report, the other lab will show completely different metrics. So now who do you trust?
That's true. Like I know some patients who did semen analysis in an IVF center, and it was not right. And he went and did it in a neutral center, which doesn't have any IVF centers.
Yes,
The result said that is, I don't know why you got such a result.
exactly. And because of that, earlier, like when this started happening to us, we were so confused. Um, but this is what is happening. This is the reality. So we say at least like go to 3 centers.
Hmm.
Especially couples who have, they have tested before, like maybe their reports are like 6 months back or like 1 year back, and they come and I ask them to do it again, get it tested again. And there is very abnormal differences, this is not radical. And then you test it again, there are two different reports within the same week.
Hmm.
So I really think it is a sheer luck, but I also suggest that don't go through to these very hyped up and like collaborative lab tests, because it can be manipulated. I'm not saying that it always is, but most of the time it is manipulated.
I have made so many patients redo the test in a different laboratory just to assess. Sometimes
Yes,
suddenly you see the spike in certain numbers.
yes,
Sometimes, not all the time, about 50% times, when I redid the test in a completely neutral laboratory, the results have been quite starkly different.
yeah,
So that's another aspect that also needs to be tested.
absolutely.
And
So
this can play with their anxiety and stress also.
a lot, quite a bit, because unless you start, like I was saying, unless you start living holistically, how will you become aware of your sleeping patterns?
Hmm.
According to you, you are sleeping well, right? But once for example, once you start practicing yoga nidra,
It'll have a
non-sleep, yeah.
huge impact.
So that quality is going to change. But unless you try it, you will not know. So medically, this is how we start. That you get your body checkups done. If you have insulin resistance, anything, many women come up with fibroids and cysts, right? A lot of that can be treated with Ayurveda also, we know that. So again, as soon as you see a problem, see the holistic approaches, what can be done holistically as much as possible,
Mhm.
right? So that's what we do. Other than that, my approach is regardless of the reports and other things, just start working on your nutrition.
Mhm.
Get on a plan. Start.
So, what when it comes to nutrition, what are your most common problems that you see and the advices that you've given
So the most common
when it
one,
comes to fertility with both male and female?
it's so common, and it's nothing new. Junk, junk food, processed food, irregular, erratic timings of eating,
Hmm.
and stressful eating. Stress eating, especially the window after 3 p.m.
Hmm.
All stress eating, and then very late dinners, right? So All these are, and very high carb meals. Like I eat only home food. जैसे मैं घर का ही खाना खाती हूँ. I eat only home cooked food, but it's so high in carbohydrate, and there is no movement in our life to digest all of that. So each to their own, because there are couples who have very hectic jobs, field jobs, like someone working in a lab who's on her feet all day long, someone who's traveling in the train for like 2 hours back and forth. So it really depends on how much you can digest. But what we do is, because I parallelly anyway suggest Panchakarma, they are on a sattvic diet, right? And after that, we see that what their lifestyle is like, and then we create a balance between the macro and the micro. Because I know the world is all about protein right now, but most issues are happening because of poor vitamin and mineral profile,
The deficiencies.
the deficiencies, because people are focusing only on macros. So that's another thing
That needs to be understood.
yeah. So the world is anyway changing. I'm not too protein or high protein person. There has to be a balance in everything. Sometimes they need to be at least one meal has to be completely grain free, right? And then
Which meal would you recommend to be grain free?
um,
Dinner or lunch?
I usually recommend breakfast, because dinner, again, I have seen that emotional regulation is better if you have some carbohydrates and grains in the evening. But again, depends, because some grains are harder to digest, right?
Yeah.
Rice based meals are very good, healthy to digest in the night. So again, depends on the person and the intolerances. Mainly it's about bringing diversity. See, the people that I deal with, and if we are talking about metropolitan people, what they are missing is diversity. They are too much into imported foods and very less into local diverse foods, and because of which they are not eating very day to day vegetables that they should be eating. So again, gut microbiome is not very healthy. So all these problems are happening. So you need to assess, like, um, depending on their daily routine, right? And what do they really need? Like a student would eat differently, right? A worker, like a physical worker, would eat differently. A IT person should eat a little differently, maybe even 2 meals without grains, because they don't
Depending on their physical activity.
yeah,
also.
because they don't need it. But if you go through certain therapies and processes and you improvise your, like, you eat what you can digest basically, right?
Yes.
So first you focus on your digestive fire, your jatragni, and then you can go, like, eventually, if in my plan the person is supposed to be more active now, so we balance that accordingly
Now tell me, where does Panchakarma fit in?
as the first step. As the first step to conception, like I said, if you have thought that, let's have a baby, and because you're not going to understand a lot of markers, and just know that by the time you have lived so much of your life, of course there are some known unknown parallel damage that has happened, right? So without even assessing, get panchakarma done. Don't even do all these reports and all before that. Get your panchakarma done. Feel what you need to feel during that process. Feel that life energy within you. Feel that mind expanding, right? And then you come back, do your reports, consult with someone, get on a plan, work on those 90 days, right? And in that, of course, lifestyle, the basics: exercise, sleep, yoga abhyas, meditation, and not everything together. That's why you need someone to guide you, because again, you're going to take up a lot of load, because people think, today I missed it, and they keep on thinking about it. So a plan needs to be in place. Next, also start thinking about what parenting style you are going to adapt, right? What world do you want to bring that child up in? Because a lot of couples I know, they also make a decision to move from city to a rural or a small town, or maybe the mountains, whatever pleases them, because initially the child just needs you mainly, right? So what is the best place to raise a child right now? Just look around your friends, right? Look at their babies. Look at your friends, how are they parenting? Look at the babies around you. You will learn a lot. Just if even if 2 days, I'm telling you, if you live in a society, Just go down in your play area in the evening and just observe the children for just 20 minutes. You will know what the young minds are like and what is happening. I have school teachers coming to me scared of having children because you know how
Or the kind of
children are,
children are.
right? And the predominant environment is parents, it's not even the home. They have no concept of a home.
How do you help these anxiety first? Sometimes they'll come with anxieties, like like you said about the miscarriage example.
Yeah.
So there are like the school teachers seeing hyperactive children quite uh, can be very naughty and disruptive. And if that sinks into, then how do you help them to get rid of that anxiety? It'll be a challenging thing.
It is challenging, so counseling definitely helps.
And what will be that
Uh,
counseling part? What will be
so
the main thing that you'll
just
tell them?
talking to them, because this is what is acquired memory,
Mm-hmm.
right? Everything they have gathered from the environment. If I just talk to them a little bit and just close your eyes, you know,
Mm-hmm.
and then just prompt them with certain questions. Just ask them what their childhood was like, right? And slowly bring them up to where they are right now. What was their journey of life? And now, if you want to have a child, what environment do you want? But because their eyes are closed, they're very calm. So, answers most probably are coming from the subconscious.
Mm-hmm.
So, these are your answers,
Mm-hmm.
right? This is what you believe, but because it's not in repetition, it's not affirmed in your mind. So then the next step would be start doing your affirmations, because this is your belief and it's totally up to you how you want to raise that child, what kind of a mother you want to be, what kind of father you want to be, and this is what I want my child to be. Why do I even want to have a child? Because chances are the people that they are comparing themselves to, they've just gotten pregnant, had a baby, and just moved on in their life. There's no intention over there. So that's why also knowing about suprajanan, right? So the child that you're going to have is going to be a part of the society, going to contribute to the society on a very large scale if the impressions on the child's memory, the conditioning, the emotional intelligence is developed, mental faculty is developed, physical body is good enough, he will definitely do something good for himself, for the people around him. Otherwise, the whole life is a struggle, and we all know it, right? And they say now in Garbha Sanskar, it's because Garbha Sanskar is getting very popular, right? And everyone does want to give a birth to the next Krishna, the next Shivaji Maharaj. Like, that is what it is being promoted as. But Garbhadhan, like Ayurvedic concept is Garbhadhan, right? But the program that I do is Garbhadhan. Now, the whole idea around it is the children are not coming for you. The child is going to come through you. We are all coming through each other.
You're just a channel.
Exactly. So just stay with that, because, you know, if we see the previous generation, everyone has some or the other trauma. Like, this is a very popular word right now also. Not denying it, but also it's used very unnecessarily as well. Mother wound, father wound, like, you know, this is happening because of lack of understanding of the nature of life itself as a soul. So there's something called a soul journey as well. The child also that is coming to you is choosing your womb, choosing your family. So are you creating that environment? Right now we aren't really speaking too much about the spiritual aspect, but this is also true that if you just read a little bit about souls and reincarnations, you will see that is how your grandmother might be born through you again in the same family. So what are the bondages that are tied? So once you're fixing your health, improve your intimacy, improve your communication with your partner, but also look at, do you have any kind of doshas that are going to impact your progeny, and then work on that also. You have a lot of time in those 90 days. Really prioritize it. If it feels too crunched up, go 6 months. Who's stopping you? But clear your dues as much as you can, especially in terms of Pitru Dosh also. Clear your dues.
I don't remember which book, but I think it's a book by Tim Ferriss. He has written, today we are obsessed in a world where we need to wash our hands after we pee.
Yeah.
But most importantly, you need to wash it before. It's a very funny way to look at it,
Yes,
but the point is why it's so important to prepare, cleanse yourself, purify yourself, set a good intention, and also remember a new soul is coming in through you,
exactly,
and you need to, and they don't listen to you, they will imitate you.
exactly,
And these are the aspects that we need to be prepared. So it's a very spiritual uh, a revolution that is going to happen inside you. And they
absolutely.
say it's not the child gives birth to the mother, that's child gives birth to
Exactly.
the
When,
father,
yeah, when they say,
because
I'm not ready to be a father, of course you're not ready to be a father. You haven't had a child yet.
when IVF should not happen, and when do you think they could go for an IVF in your experience?
So let's start by a common statement used by most couple. We have tried everything, still it's not happening. Now, what does that everything mean? Let's say that they have started exercising. Let's say they are eating well, sleeping well, everything is good, right? But again, the stress adaptability, the nervous system, basically, what I'm talking about, if that is not regulated and your emotions are not regulated, right? Still, it is not going to work because most of the cases I see, and the first transformation that I see in the programs is the moment they reduce their social media usage and the moment they start doing yoga abhyas, the mind starts becoming calmer. And because what are emotions and feelings? At the end of the day, it is just hormonal reactions happening inside of you,
Yes.
right? Now, the root of every thought and emotion, every emotion and feeling is a thought,
Hmm.
right? And another mistake is I keep on thinking. It is not you who are thinking, it is the mind that is running, right? When have you really sat and thought about things? Or are you thinking like one thought per second? No, it's the mind. So, one thing, differentiating between that.
Hmm.
And then doing practices that will calm down your mind because, again, Ayurveda says, Sau manasya garbhadharananam, right? So it is a result of peace of mind. So doesn't matter what all you're doing, no doubt it is going to benefit the mind. But are you doing any specific practices for the mind also is which I'm going to assess.
Hmm.
What, like, when the person speaks to you, they say a lot about how their mind works. Right? If you just listen, the language that they use, the words that they use, the sentences that they frame, right? So it tells a lot about the quality of their mind. And if that is not relaxed, and they are doing everything in paranoia only
Hmm.
because they are scared, that's why they are exercising, not for the benefit.
So the question, when to go for IVF, when not to go.
Yeah. So once you have fixed all these things, assist your mind also, mental habits also, emotional habits also, and it's been a year, then go for it.
Hmm. Dedicate yourself at least for 1 year, and then.
Yes. And on top of that, there is an option called IUI also,
Hmm.
right? So you have to know na, why it is not happening, why you are going for IVF. Means not happening is not the reason. Why is it not happening? There should be a reason.
Hmm.
Because otherwise, so IUI is also a good option.
Hmm.
And now there are like at home kits also being built.
Hmm.
Do it at home only.
So that's, on one hand, technology is quite
It's
interesting.
rapidly growing. But again, assessing this something is lacking. Na? So, like, what is it? Once you have assessed your health, your astrology, your vastu is another very big thing,
Hmm.
right? So, once you have assessed everything, still nothing is working, and you have tried in a very healthy state, right? Then you go for IVF.
Hmm.
But usse pehle, like before that, also see what options you have.
Understood. Yes.
Then go for IVF because most cases, I'm telling you, most cases will not need IVF.
It's just fear mongering that they became a
Yes,
victim of.
yes. It might take you 2 years.
Hmm.
Give it 2 years. Understanding that, see, whatever comes through, I'll tell you, whatever comes through IVF also, if that is also not nurtured and taken care of, you're still going to be miserable in that parenting journey.
Hmm.
Another thing, the consequences of it, right? Now there is awareness, but if you do IVF, the first 3 months you're on bed rest. Imagine any person on bed rest for 3 months,
Mhm.
how their mind is going to be, how their body is going to feel like. And there is a constant fear of losing that pregnancy
Mhm.
every moment because it is artificially done, na? Because you know already the body is not capable. And that is why so many IVF failures also happen. What I preach is also chalo. I can't control your choices. You have to go for IVF. Okay, prepare. Prepare for IVF so that you don't need multiple rounds.
Hmm.
So um, I was counseling couples at an IVF center. A lady who is in the 8th month of pregnancy, she's almost about to deliver, but she's so scared all the time. Every consultation we meet, she goes back very fine.
Mhm.
With some practices she'll do for a week or something, she'll be fine. Again, all the fears creep in. Some ache and pain here or there, and she's completely scared.
Hmm.
Now, imagine if that emotion goes out of control, the hormones are going to go out of control, and something might happen.
So, Saumanasyam Garbhajananam, such a powerful part.
Yes,
I think that's a very insightful conversation, Siddhanta ji. I think there's a lot for people to take notes here and to
absolutely.
understand, to take there. Thank you.
Thank you.